So I started as a field parole agent back in the day in Southern California. I got hired at a program called SPACE, and it was a reentry transition program. So we would interview young people from the Southern institutions to recruit them into our program when they had between 3 and 6 months left to go. And they would go into this program where we would help them get a job, find housing, and then follow them in parole, during their supervision. They would get a little bit of time cuts to be able to do that. It was a great program, but funding cuts, ended up cutting that program. And so I was the low person on the totem pole, and so I was in charge of a group home. And we called that Casa Esperanza. It was a alternative to revocation. So if a young person had a dirty drug test or had a low-level violation, they could go into that program versus a revocation. And so I was fortunate to be able to get that program up and running and staff that program. And then I came to Sacramento. I'm from Sacramento, and so I was able to come home on a training and development assignment, which was a really great opportunity for me because I was able to work in the director's office for a program that they used to call the Program Review Council. And that was Director Jim Rowland at the time, who was really a visionary in terms of juvenile justice issues. And the Program Review Council consisted of staff from all classifications throughout the department, from all facilities, in parole, in institutions. And this council would meet every 6 weeks, 6 to 8 weeks, to give the director information on program areas, advice on things that needed to happen, to share information. It was a way to bring everyone together to really communicate. And so after I did my assignment with that program, I went back out to parole. I was the supervisor of the Stockton Parole Office, then the Sacramento Parole Office. And then I was fortunate to do a special assignment for a branch that we had that was called Prevention and Community Corrections. And that branch worked with probation and also with community organizations. I was the first consultant to work on a bond act. It was the first bond act that California passed to fund nonprofits and organizations to build youth centers, youth shelters, and youth runaway facilities. So I was able to work on that, develop legislation to implement that, and fund programs throughout California. So that was really just a great opportunity. Went back out to parole, went to a facility, Northern Reception Center Clinic, and was assistant superintendent there. And then, of course, that facility closed in 2004. Went to headquarters and worked in intake and court services, where we were in charge of accepting or rejecting every youth that came into Youth Authority or DJJ, as well as all of the transportation, making sure youth got to the facilities they needed to be, and all of the master files, court records, which was a great opportunity, And from there, I became the director of juvenile parole. And after parole was transitioned to the adult division, I became the assistant deputy secretary, and then I became the director of Division of Juvenile Justice. So long career, many different branches, many different opportunities.
What would you say were the changes that you observed as CYA became the Division of Juvenile Justice?
Wow. There were so many changes throughout my career. I saw the department transition several times. And I think the biggest change that happened when the shift came from Youth Authority to Division of Juvenile Justice is a real disconnect with staff and with the community in terms of why the change was happening. First of all, it wasn't just a change in name. We became part of the adult division. Prior to that, there was an agency secretary who had two separate departments, Youth Authority and CDC, Department of Corrections. When the shift changed, it was one agency, and we were no longer separate departments. We were divisions of the one agency, the one department, which was the California Department of Corrections and Rehabilitation. So the biggest change was a loss of autonomy, a loss of direct access to the secretary or the governor's office, and it was kind of an inclusion into this bigger adult kind of world. That was what I saw is the biggest change. I think that at the time, the thinking was that this would streamline access for young people, but really what happened is administrators that were mostly from an adult corrections world did not really understand the special needs of juvenile justice populations. And so to some extent, there was better access to that high level, secretary, but to other extents, it was a disconnect in terms of the needs, the educational needs, even the nutrition needs that young people have from adult inmates, right? And so I think it was a little bit of a challenge to be able to ensure that the programs and the services were moving in the direction that was intended to.
During that period of time, didn't the population also increase?
The population increased actually prior to that. And so when you look at California's demographic, we see that the bubble was coming through in the late 80s and the 90s, right? Just in general, number of young people, right? You see a big influx. And whenever you see a big population of youth, you're going to see a higher population of youth that get involved in, criminal behavior. It's just follows the numbers. And so, but we had something different happening, as you know, in the late 80s and the early 90s, we had the explosion of gang wars, we had the explosion of crack cocaine. You had so many issues that impacted local and state, juvenile and adult correctional systems. And so that's really where you saw a lot of the growth that happened is in the late 90s and in early 2000. That's when the population in Youth Authority was over 10,000 young people. Local jurisdictions didn't know what to do. At the time, there was also a sentiment of these were called super predators, and the whole country in general was really not looking at juvenile justice reform, but they were looking at tough on crime, legislation, and wanting to make sure that people were held accountable. You saw laws change where you saw young people being able to be remanded to adult court at an earlier age from 16, and a decision that the juvenile court made to 14, and a decision that district attorneys made. So all of those were impacting what was happening in the juvenile justice world and in the adult correctional world too, and that's where you saw that large increase. By the time 2005, 2004, when the agencies merged, the population was already starting to decline. We were already closing facilities because the population was already starting to decline. And already at that point, we were looking at changing legislation and creating policies that would encourage local jurisdictions to keep their youth at the local level versus committing them to adult divisions. So for example, you know that there's a category for youth, right? Category 1 through 7, and a category 7 is a lower offender. Category 1 is, a serious offender. Counties would be charged significantly higher for category 7, so that there was a monetary, penalty for sending someone to juvenile justice because they should be handled at a local jurisdiction. So only those most serious offenders would be a lower cost for counties to send to them. Sometimes that didn't work, and so then laws came into place that said you couldn't send lower level offenders to Youth Authority, right? To try and keep local counties, to keep them at that level. We were seeing a lot of young people that were coming in with a lot of mental health issues. Again, the results of trauma, the results of gang violence, the results of drug addiction, they called them the crack babies, and So a lot of young people with a lot of needs were coming in. And so we would look at that. That's part of what our job was in intake, is to determine whether this was really an appropriate commitment. Did this young person need mental health services, or did they need detention, And so trying to look at ways that we would discourage commitments into youth authority and keeping youthful offenders in local jurisdictions. That was already in place when the agencies merged. So that it wasn't because of the population booming after that. It was actually already on the decline. So during the period of time when we had 10,000 young people committed, the conditions of confinement were not appropriate. And there were a couple things that were going on. As I mentioned, we were getting more and more young people with severe needs, more and more young people that had special needs. And we always had special treatment programs, ITPs or SCPs, and intensive treatment programs and specialized counseling programs that had separate units for young people that needed those services. They were more richly staffed with social workers, higher staff ratio to young people. As we saw more and more of those young people, there was a need for more and more of those specialized treatment programs. But with funding cuts, where are you going to get the extra staff that were needed for these programs? And so some of the decisions that were made were to reduce the staffing on your general population units. These are your regular units, your regular kids, many of them who were gang-involved kids that did not meet the specialized treatment program, but still had a lot of needs. And so as those general population units decreased in staffing, what happened is those kids were sent to their rooms more often because there wasn't enough staff to do programming. And it wasn't safe for staff to do programming if there was just a smaller number. So what happens when you put a lid on things, right? It eventually will blow up. And that's what started happening. The conditions of confinement for the general population became unbearable. Young people were spending more time in their room than outside of their room. Education was limited. You were seeing a lot of violence in those units. Part of that was also, coming of having more, whatever's happening on the street is going to happen in the institution, right? If you're seeing more gang violence in the street, you're going to see it when they're detained in the institution. And so a lot of those were, factors that led to the conditions of confinement not being acceptable. And we lost our way, quite frankly. We lost our way in being able to provide that service for a lot of reasons, right? It wasn't necessarily that staff didn't want to do the right thing. And it wasn't that policymakers could have seen that this was going to happen. Financial restraints on the agency, we're seeing more and more mental health cases. We need to put the resources there, but it shouldn't have been taking resources from one to do the other. It should have been just adding resources to those areas so that we would have been able to address that need. In some ways, Farrell reminded us of what the purpose was of why we were there. In many ways, Farrell was asking us to do what our mission was, which was to provide young people with adequate education, to be able to provide treatment programs for young people, to make sure that, people lived in humane living conditions, right? That we did not detain young people, inappropriately. And so in many ways, they reminded us of what we needed to do. In other ways, it was very difficult to implement Farrell because there wasn't a coordinated approach in terms of how we should implement it. And it's also hard to implement when you're closing in between. So as I talked about the arc of population coming up to the high of over 10,000, naturally as people aged out and there were less births, of course less youth, the arc started to come down. And that arc, as it started to come down, we started looking at fiscal issues again, and cost effectiveness of keeping as many facilities open. So closures started occurring more and more. So it's really hard to keep your team motivated about this new future and this shared vision when people are losing their jobs and you're closing facilities. And even for young people, to know where's their stability. So the timing just, was off. So there was you know how the lawsuit worked. There is a special master, but you had different experts. And so early on, the department was actually the one that asked the Department of Justice to look at this issue, right? Because we had these complaints about conditions of confinement. And so the department asked the Department of Justice to look at and to develop a report on what were the problems and what the department needed to do to address these issues. Were these things really happening? And so in that report, the Department of Justice identified these various areas that, yes, the department could improve in. Some of them were not part of the initial lawsuit. They were just things like, you should have sex offender treatment. There should be more programs for sex offenders. And so there were some things along those lines that were recommendations. What happened is that report then later became the foundation for what would be the federal lawsuit and all of the special experts that were needed for each one of these areas. Again, because they were not necessarily meant to be separate issues, it was meant to be a bigger issue of conditions of confinement. It was a little bit challenging to kind of wrap around, well, where do we start? Where do we start working on this? How do we address this? And initially there were, multifaceted approaches, right? So you had an education expert and who might be working against what, a program expert might be saying. So everybody felt like, the youth should have this many hours of education, but then where are their hours for counseling? And so there was a little bit of kind of pull, who's gonna decide. We were fortunate to have a special master that then was assigned to kind of coordinate all of the experts and help us get on the same page. And really, the department was also fortunate to get, at the time it was Mike Brady, who had a court compliance unit that kind of created continuity of, wait, how are we going to reply to all of this? This expert's saying this expert's saying this. Let me, push back and say, what can we do? What's appropriate that meets both the needs? And so that took several years into the lawsuit before the department was able to create the infrastructure to be able to adequately respond to all those experts.
Do you think, though, in the long run, that the outcome of that was positive for DJJ?
Well, it's closing.
Yes.
So I think the question would be, is that outcome positive for young people? Right, so the whole intent of Farrell, the whole intent of DJJ, the whole intent of any juvenile justice system should be, how is it making a change in the lives of the young people that are impacted? And so the question is this new system going to be better for young people? And I think we don't have the answer yet. It's important to recognize that Youth Authority and DJJ did not go out and recruit these kids. These kids were sentenced to us by local jurisdictions, which meant local jurisdictions had the opportunity to address those issues in their local communities way before they ever came to a state system. And so if they were challenged in addressing them at that point, what has changed now that they'll be able to address those issues now? And so I think the real emphasis needs to be on how do we support those local jurisdictions and how do we ensure that they are doing the right thing by these young people, that we don't have unintended consequences of just pushing these young people to an adult system. Because at one point, as I talked about the different laws that were enacted to say, we're discouraging you from sending low-level offenders to, Youth Authority or DJJ, some of the consequences of that were that DAs just tried young people as adults, and there was a huge increase in adult court commitments. which was not the answer. That's not what people wanted, right? DJJ and Youth Authority were supposed to be a last resort for young people to give them a chance to change their lives and not push them into that adult prison system. And so we want to make sure that that doesn't happen. You know, there have been some advocacy efforts to shift to make sure that we have some safety nets. So for example, laws have changed so the DA cannot unilaterally decide they're going to try someone as an adult, which is a great, you know, accomplishment, to make sure that juvenile courts have a say, that there is an assessment to determine what's the right appropriate course for that particular individual. But we need to do a lot more. We need to ensure that the resources that have been allocated to local jurisdictions are actually used for programs for local jurisdictions. So one of the things that I was the most proud of Youth Authority and DJJ was our parole system. We had a parole division that really, for the most part, really focused and cared about young people transitioning them successfully into the community. Of course, you know, there was accountability, you know, making sure that the streets were safe and that young people were not getting involved in further criminal behavior. But by and large, the focus was on helping them transition. So almost every parole office had an education program, a school, whether it was a parole school that was run by the state or whether it was in partnership with the County Office of Education. Every parole office had mental health counselors. Every parole office had sex offender counseling. And we also had the Department of Employment Development, EDD officers or staff that would come and help young people with jobs, because the focus was really on helping young people transition into the community, helping them with group homes if they didn't have housing. All parole offices had some type of resources for housing. I'm not sure how that works now in this new realignment world, if there is that concentrated effort of being able to provide that level of services. And so that is really where we hope that the local jurisdictions will work with community organizations to ensure that young people, as they transition out of detention, have those support systems that they were lacking in the first place that got them into this. And that's those support systems that will help them move out through this. The counties have gotten a lot of resources. When you look at there's the various jurisdictions, the 58 jurisdictions, it's a lot, right? One of the issues is there's an economy of scale when you put everything together. And so when you have a state system, you can provide deeper levels of services because you're coordinating all of the resources together. We understand it's a challenge for each individual county. A small county, like Modoc or Siskiyou, how are they going to be able to have the same level of resources for 3 or 4 young people as maybe Los Angeles or Sacramento County? And so that is going to be a challenge, and I believe that some counties are working together to be able to put their resources together and create those opportunities. So that is a challenge. But by and large, larger counties have been given significant resources to be able to modify their facilities if needed and to be able to offer those programs and services. One advantage that the counties have that the state didn't have is that services like mental health services are county services. And so the county is already obligated to provide mental health services. So that's something they don't necessarily need to spend a lot more on. They just need to tie into those systems that exist and see how we can engage and enroll young people. And so creating those warm handoffs to those support systems for young people, I think those are going to be the biggest challenges for counties. Creating housing opportunities for young people and connecting them with employment opportunities so that they can, restart their lives. Sometimes we just remember the last thing, right? The most recent thing. And that is not necessarily the most positive light on the department. And so I hope that's not the only thing it's remembered for. We have to look at the fact that in our history, Youth Authority was the leader in juvenile justice nationwide. When people are now discovering that brain development doesn't happen till 25, The founders knew that and created jurisdiction to age 25. We were the only state that had jurisdiction to that age, right? So when people compared youth authority to other departments, other states, I should say, most other states only kept juveniles till 18, maybe 21, but mostly till 18. So they weren't really working with the same youth that we were working with. We were working with 19, 20, 21-year-olds, 22-year-olds, right? Because we understood, the founders understood that brain development didn't finish until after 25. And so young people made really bad mistakes still, and wanting to give them that opportunity to change their lives without them being, forever considered into the adult prison system. I hope that people will look at what those programs were when we were the leaders in juvenile justice, that we did have visionary people that cared about young people, that created programs that were important, the people who started parole, who looked at the fact that re-entry was an important part of the youth's detention. From the point of entry, you should start re-entry, and that we're looking at those type of services, that looked at mental health services as part of treatment, that recognized the importance of incorporating that looked at sex offenders, juvenile sex offenders, differently from adult sex offenders. And I think, as Dr. Bowles will always say, that when you look at juvenile sex offenders, the majority of them will not go on to reoffend because they're either acting out something that happened to them, don't know boundaries, and of course there are going to be some that are in fact predators, but the majority are not. So understanding that, and the founders knew that. They knew that young people needed an opportunity to change their lives. We know, though, that we lost our way. And it's hard to ignore that what happened in DJJ. And it's hard to ignore that after years of being the leaders, that the agency is closing. It doesn't mean that there isn't a need for state-level detention. It means that we are looking at how local communities can have more of a say in their youth. And I think that that's a good thing. We should try and keep young people closer to home. But we should always look for opportunities to give young people before we make those big decisions of sentencing them to adult prisons, And so it will be a difficult story to tell what our history was. I hope it's balanced. I hope that historians will balance some of the amazing programs that came out of Youth Authority and the incredible commitment that staff had to young people, as well as some of the very grave mistakes that were made and things that happened that kind of led us here.